Okay, so I'm going to be going over the OHI for this patient. This patient's dental health diagnosis recorded over 60% for perio, which is the bleeding on probing. That means when we were probing, more than 60% of the surfaces bled. For caries, the patient is uncontrolled. They have active caries on number 3, 12, 14, and 31. As for oral hygiene assessment, which is the MBI and plaque index, they also had a reading that was greater than 60%, which means that the MBI and the plaque index, when we did the disclosing tablet on the teeth, on the surfaces, we saw that there was plaque in more than 60% of the surfaces of the teeth. Okay, so for patient education on etiology and progression of the periodontal disease, we know that the patient experiences diabetes, which is associated with periodontal disease, so that could be an etiology. And then we also want to recommend nutritional counseling for the patient because they have diabetes and active caries, and nutritional counseling will help hopefully resolve the active caries and maybe control their diabetes. Their last visit was also 7 years ago, which could be a reason why they're experiencing caries. They didn't get that preventive care in 7 years. So, and then also the patient experiences xerostomia, which is dryness of the mouth, and that's also a reason for increased risk of caries. The patient also has arthritis in their hands. This could limit their ability to brush their teeth properly. If you're experience pain, then you're not going to be motivated to want to brush your teeth. The patient also battles depression, which also has effect on motivation to perform daily home care. Alright, so for the patient-centered home care instructions, based on the assessments, for toothbrushing, we want to recommend an electric toothbrush. This has to do with the patient's arthritis. Since they have limited dexterity, we want to find a better option for them. Maybe manual toothbrushing wouldn't work as well. And then we also want to recommend them using a pea-sized amount of Parodontax toothpaste. This toothpaste is great for them because it's actually anti-cavity and anti-gingivitis. We want to instruct the patient to use this and brush their teeth for 2 minutes twice daily. And then we're going to demonstrate how to brush their teeth. Okay, so we want to show them the model and the toothbrush. We're going to pretend like this is an electric toothbrush. We want to hold a toothbrush at like a 45-degree angle to the teeth. And then since the toothbrush will be rotating and then it will be hard for them because they have arthritis, we're just going to show them like which angle to go at the teeth and make sure that they go over the occlusal surface because they also experience cavities. We want to make sure they're not missing that part. Then also on the lingual side. And then we're going to just have them show us how to do it all around the oral cavity, the mouth, and every surface of the teeth, just to make sure that they're doing it correctly. Alright, and then also for mouth rinse, we want to recommend Listerine Total Care, 0 alcohol. This is because Listerine Total Care says that it prevents cavities, restores enamel, strengthens the teeth, and kills bad breath germs, and cleanses the whole mouth and freshens the breath. This is good for the patient because 1, they have active caries, 2, they are experiencing periodontitis, and then 3, they also had a complaint that they're experiencing bad breath, so this could help eliminate some of that odor as well. Alright, so the goal for the patient is to believe that she is susceptible to disease progression. So we want to try to motivate her to change behavior, want to motivate her to start brushing her teeth every day so her disease doesn't progress into something worse. We could tell her, like, for example, periodontal disease can lead to bone loss. And since she is already experiencing deep pocket depths, she's susceptible for that. And bone loss could also lead to losing teeth. We don't want her to lose any teeth because procedures could be quite expensive for like implants and stuff. And we just want to try to motivate her to start taking care of herself so it doesn't lead to that. And then also, another thing that we saw during assessment is that there is a white lesion on the left border of her tongue. We want to call her back for reevaluation if it doesn't resolve, but we also want to keep in mind, since the patient experiences xerostomia, that it could kind of affect the healing process of that. And then also, since the patient has type 2 diabetes, it also affects wound healing. So want to keep an eye out for that. We also made a referral for the general practice, and that is because she has cavities on number 3 occlusal, number 12 distal occlusal, 14 mesial occlusal, and 31 occlusal. And then we also have a recommendation for a periodontis, and this is for tooth number 19. And then we want to ask the patient to come back in 3 months because of her situation. And this is just to ensure that she is following through with proper oral hygiene instructions that we send with her.